Hey everyone, Dr. Josh here from Freedom Physical Therapy and Wellness, and we're going to start a new series that is going to be a weekly kind of coaching tip on a specific exercise or a specific movement and how to improve that movement so that you can have decreased injury risk and improve your performance. Today, we're going to start with the hip hinge. So hip hinge is a really essential motion for a lot of lifting exercises, whether that's the snatch, the power clean, the hang clean, and the deadlift are the main kind of three, but we also use this if you think anything where we're bending to pick up off the floor, so it becomes a really useful thing for day-to-day life as well. To start with the hip hinge, we're going here, and it is this to then stand up. With this, a lot of the times what we'll see is a shift or kind of like dumping that pelvis into this tilt, which causes the back to go into extension and puts a lot more pressure on our back. With that, an easy test you can do to kind of see this is if you squeeze your butt cheeks, does your pelvis change position? And I get a little bit of a tilt as I squeeze the butt cheeks together. I get a little tilt backwards. So if we think about this, when we're at the top of that deadlift, or if we're at the top position, we got our butt cheeks squeezed, we get that nice extension position. As I go down, I have to be able to fight some of this tightness in the front to be able to prevent my pelvis from just dropping forward and go into this knee bend position rather than a nice hinge position with my hip. The other thing we want to look at is we don't want any kind of deflection or flare through the rib cage. So if I think my rib cage stays down from my sternum here to the front part of my pelvis, I should have zero kind of twist or like rotation. So I should be here, and I get rotation all through my hip and not through my back. And I should be able to hold this position and breathe and maintain this nice neutral curve in my spine. We don't want to be too rounded, but we also don't want to dump into that extension. So really good thing you can do, a good exercise, is take a little elastic band. I like to put it around kind of the neck, shoulders first, and then step on it. And then we're going to go into kind of a banded good morning here, but we want to really focus. So squeeze the butt cheeks, really make sure that our rib cage stays down. Everything's nice and tight through here. I'm pushing my hips back, being able to maintain that nice neutral spine, and then stand back up. You should feel this load more in the glutes and then in the hamstrings as well. The other thing that often gets us thrown off is our weight distribution in our foot. So I prefer to do deadlifts barefoot, so that way I can kind of see and gauge where on the floor my foot pressure is. So if I'm too far onto my toes, that bar is going to want to lean forward. I'm going to lose my center of gravity. I'm going to get way too far out in front, and I'm going to get that more rounded back posture. And if I get on my heels, I'm going to get more of that, especially as I stand up, I'm going to get that kind of backwards lean. And I'm really going to not have a steady, consistent deadlift, especially if you're talking about barbell cycling. So more than one rep at a time. We want to try and maintain that constant, even pressure through the foot, that rib cage stays down. Here, stand up. So hopefully you all found this helpful. If you have any questions, please feel free to contact us, send us a message, comment. We enjoy hearing from you, and hopefully you found this helpful and can implement this into your workouts, warm-ups, and even your daily life. And we'll see you all next week for our next training tip. Thanks.